Well, hi, Jackie. It's
Hi, nice to see you, Pam.
and you too, Jackie. I mean, when I think about how long we go back, 3 weeks after I arrived from San Diego, there we were in La Jolla at the homeopathic. It was a convention, right?
A convention, a conference in the
Right.
1970s, probably was
Yeah.
1970, late
Nine.
70s, 79.
79. Yeah. And so, I mean, that's quite something. And I think the thing that I loved the most about meeting you and knowing you from then was that it didn't matter what homeopathic question I had, I could ask Jackie and she had an answer for me.
Right.
So,
I was beginning my study of homeopathic medicine then, which I began it in 1975, 76. And there were, as a medical doctor, I had a family practice.
uh-huh,
It was called family practice there. Now it's called family medicine.
uh-huh,
And I was learning ways to restore health, because I really wasn't interested in just maintaining health with drugs on a daily basis. That never really caught my eye, except for emergency situations. But
uh-huh.
for the walking well, I thought it was not good for those people to be taking strong chemical drugs every day just to reduce symptoms. So I was exploring at that time ways to stimulate healing in people, and I latched on to homeopathy, which I had known the word, but I really never saw anybody that practiced it until I
Really?
moved to
Mm-hmm.
California.
So, what I'd like to know from you now is what you're doing now. I mean,
I'm
that's
still I'm still involved in homeopathy. Homeopathy is exploding around the world. There are more and more people using it. More and more pharmaceutical companies are interested now in bringing out homeopathic drugs, although it's not mainstream at all. But what I do now is help companies who want to bring out homeopathic products bring them out,
uh-huh.
and that's that's mainly where I'm working in homeopathy, and I'm a member of the Homeopathic Pharmacopoeia Convention of the United States, which is a nonprofit organization that works on maintaining the homeopathic pharmacopoeia of the United States, which is a big book with 1,200 homeopathic medicines in it. And then these medicines are regulated by the Food and Drug Administration.
Uh-huh.
So they're in our Code of Federal Regulations, and homeopathic medicines are classified as drugs in the United States. So
Uh-huh.
they're required to be labeled as drugs and packaged as drugs and manufactured with good manufacturing procedures. So I help in all of those things, mainly startup companies that want to get into this business but don't know anything about it.
Uh-huh. And so then how do you integrate homeopathy with your integrative medicine practice?
Oh, the integrative medicine. I recently become board certified in integrative medicine because I stopped my family medicine boards that I had for like 30 years, but I really couldn't get on board with them any longer. I was too philosophically different from the
Uh-huh.
way family medicine has evolved. But there's a new group of doctors that started an integrative medicine, holistic and integrative medicine board, and that teaches all types of healing modalities. We call therapies, all types of therapies, from mind, body, and yoga, and meditation, and nutrition, to homeopathy, acupuncture, traditional herbal medicine,
Uh-huh.
manipulation, and regular allopathic drugs, regular pharmaceutical drugs also.
Uh-huh.
Integrate all of that depending on what the patient wants, what you know how to do as a doctor, what your areas of expertise are, and that's how you practice. So that's called integrative medicine. And
And
I think that's the wave of the future, because we're integrating people from all over the world that have different cultures and want different things and seem to respond to different things. So
and,
that we're in the integration of medicine right now.
That sounds a much more beneficial approach. But also clarify what the difference is between integrative medicine and functional medicine.
Oh, there's a large group of medical doctors and osteopathic doctors now who, about 15,000 of them in the United States, who have studied functional medicine. And that really is the biochemistry of the body and how you can influence it and change it and diagnose it when it's not doing well. And then you can add back usually different minerals and vitamins and food supplements
Okay.
into a therapeutic program, and it can help people get well that have chronic disease. We're talking about here chronic disease and functional medicine.
Yeah. Okay. And so, um, do you see patients?
I see patients rarely.
Uh huh.
As a consultant, I like to do home visits. I'll work with patients, usually like a one-time visit or one or two-time visits, and the person would have many different chronic diseases and would want to know what to do. I seem to have a certain insight in some things that might be helpful for them to get a handle on so that they can help their healing. So I like to do that, and I spend 2 or 3 hours with them going over their whole medical history, the family history, what the big stressors are in their life, really what they want to do and what they're not doing, and I encourage them. I usually find a homeopathic medicine, a single medicine to give them,
Uh huh.
a higher potency usually, and it would be like a classical homeopathic interview.
Uh huh.
So I do that. Hmm.
That sounds like you have integrated all the things that you know in manifesting the best possible Dr. Jacqueline Wilson, because having known you for the length of time that um, I have been witness to that growth of your knowledge of all of that. So it's lovely to be able to do that, when you think about how restricted it used to be.
Yeah. The other thing that I did about 5 years ago, I spent 5 years at the San Diego Cancer Center,
Uh huh.
and that was very interesting. I was trying to figure out, well, can you really tell when you interview the patient, you see the patient, you look at the pathologic diagnosis, can you tell who's going to do well or who's not going to do well
Uh
in
huh.
the current treatment that we have for cancer? And I found out from my own personal thing, I couldn't tell.
Uh huh.
And so that was interesting to me. I thought with all my medical background and integrative medicine background that I might have an idea of who was going to make it and who wasn't going to make it,
Yeah.
who was going to die from their cancer and who was not. But I could not predict that at
Huh.
all.
That's very interesting.
And recently, I've had a lot of friends that have gotten cancer, and I've been looking at old medical magazines from the 1800s. There was certainly cancer in the
Oh. Oh.
1800s, and I've been reading it. I have them on my computer to read, and it was interesting to me to see the comments of the medical doctors that were taking care of patients with cancer and what they thought in the 1800s that might be triggering the cancer and how the person heals. Now, there was no chemotherapy at that time. There was surgery. People would have surgery, but often the cancer was far spread and they would have to close up like the abdomen. They had colon cancer and say that nothing else could be done. Well, then they turned to the homeopathic doctor to see if
Uh huh.
anything could be done, and the doctor treated the patient, and some of them died and others totally recovered.
Uh huh.
And they recovered in a zigzag way. One disease went away and another one came in another area of the body, and then finally they ended up with a terrible diarrhea, and they got different things, or a sore throat, or the flu. They said a lot of the patients with cancer had the flu, and if you could make it through the flu, you usually got over your cancer.
Uh huh. Huh.
A lot of them didn't make it. They died with the flu.
Right. Wow.
So it was very interesting to look at things there, because I don't think anybody has this handle on cancer there in let's see, in reading some books from Japan in the past, I read that if you had a sarcoma, that's a muscle cancer, and you got a strep throat and you survived your strep throat, the sarcoma would disappear. So it's somehow related to the strep, group A, beta hemolytic strep, sarcomas, at least in a lot of patients. So that's never really talked about. Is it something happened in the immune system when you had the strep throat and you were treated with penicillin, and something flipped and changed there and set up the scenario for later developing a sarcoma? And the fact that you can give them the strep infection again and then they can get over it.
Right.
So it knows that these cancers are tied into viruses or other bacterias. We know they're tied into toxic poisons like arsenic. If you get too much arsenic in you, you can come out with cancer on the skin, for instance.
Right.
So we know that there are different toxins that can cause cancer. But there are also different bacteria that can cause and cure it.
Right.
So those are the things now that I'm not in a daily practice where I have like an office. I don't do that. I see people either at my home or at their home. I'm free now to kind of think about different things and see how they're interrelated. And I've recently redone my website with a blog on it.
Oh, great.
So putting different posts on there.
That's nice. Good.
So that's
you know,
right.
I never did introduce you, which I think is, I want to do that because I have it right here. Just for those of you that don't know, Dr. Jackie Wilson is a California licensed physician and surgeon with a medical doctor degree from Jefferson Medical College. She is board certified in homeotherapeutics and is also board certified in integrative and holistic medicine. After 30 years of primary care family medicine practice, she now practices as a consultant so she can do as much travel as she wants. See, she didn't tell you that. So she consults with homeopathic medicine, integrative and holistic health, and deals a lot with people who are not getting better with the standard medical approach.
Right, that's a good way to put it.
Good, Jackie. So was there anything else that you wanted to mention?
No. Do you have any other questions for me?
Well, the one question I had was about other doctors. Is your approach to be able to be integrating with them?
I would say, unfortunately, no. You can integrate with other integrative medicine doctors. There's no problem when they have a conference here in San Diego and they have 1,000 doctors attending and nurses and psychologists and chiropractors and osteopaths and acupuncturists that would come together in an integrative setting. These people are coming from all over the United States, so they're spread out. But there might only be like 10 people from San Diego, where there are way over 1,000 doctors here. So it's a very small number that you're going to be interacting with. And I'm a little disappointed that the university, the medical school here, is not taking a larger role in integrative and whole pharmacy school either. So it's not happening here as much in San Diego as we would like it.
Okay. All right, Jackie. Well, thank you very much for your time. I really appreciate it. And I look forward to seeing you soon.
Okay, Pam. Have a great day.
And you too. Bye-bye.